Thanks for being on. Looking forward to hearing from you. If you want to ask a question, press star 3. Star is that button in the lower left-hand corner of your dial, and the number 3. And while we allow people to get on and have their questions screened, I'll just do a couple updates. Everybody on this call probably knows of somebody affected by fentanyl, somebody's grandchild who may have died of an overdose, or someone who's now in rehabilitation. Well, I'm pleased to say a bill that I've been working on called the Halt Fentanyl Act is headed to President Trump's desk to be signed into law. About 68% of overdose deaths in the U.S. are linked to fentanyl or something called a fentanyl analog. It looks like fentanyl, but it's not quite fentanyl. Crooks have used that as a loophole. It's not fentanyl, it just looks like fentanyl. Well, what my Halt Fentanyl bill does, if it looks like fentanyl, if it addicts like fentanyl, if it kills like fentanyl, you're guilty of pushing fentanyl, even if there's a small technical difference. Now, if 70,000 people are dying annually from fentanyl overdose, we want that number to be 0. And the Halt Fentanyl gives law enforcement one more tool to arrest and prosecute somebody who's responsible for that epidemic. President Trump's doing a great job. He has worked to secure the southern border. He is expanding the number of people going after cartels. He's pushed the Mexican government to go after the cartels, but we still need every tool we have, and this Halt Fentanyl gives a chance for the law enforcement to prosecute people who otherwise might think they could escape prosecution, and that's a good thing. Now, by the way, if you're just joining us, Senator Bill Cassidy here, Telephone Town Hall. If you'd like to ask a question or make a comment, press star 3, that button, lower left-hand corner of your phone dial, star, and then the number 3. You'll be screened. Somebody will take your question, get your phone number, and we'll be put you in the lineup to ask a question. Let's go on to the one big, beautiful bill. This is President Trump's kind of signature legislation, and we share a goal. We need a tax package which helps create more and better paying jobs for the American people, putting a little bit more money in people's wallet, in their purse. To do that, it eliminates a tax on tips. You're a waitress, you are getting a tip, and right now you pay a tax on it. In this case, you would not have to pay a tax, not have to pay income tax. We also are going after waste, fraud, and abuse. For example, Medicaid paid out $1.1 trillion in improper payments between 2015 and 2024. Textbook waste, fraud, and abuse. We're trying to stop it. You work hard for the dollars you spend to the federal government. The federal government should spend that money wisely, and that's what we're trying to do. So for seniors, we increase the deductibility for seniors, and the reason we're doing that is that it compensates you for the money, the taxes you're paying on your Social Security benefit. President Trump promised during the campaign that he would attempt to eliminate taxes on that Social Security benefit, and that's what we're attempting to do. So for seniors, he will fulfill that campaign promise working with Congress. So the tax bill's for seniors, it's for workers, it's for families. Oh, one more thing I want to talk about. There's a bill in there affecting the tax code called My Educational Choice for Children Act. And we know that some families are in a school district where the school doesn't work for their child. And what we're doing is using the tax code to create a scholarship fund so that family could apply for a scholarship to send their child to the local parochial school or private school. And I suppose they could use it for a charter school. The point being that the parent gets to choose the education for their child, and they use this scholarship for them. We address this through the tax code, and that's part of the one big beautiful bill. No one knows a child better than his or her parents, and so that's how we get to it. By the way, if you just joined us, Senator Bill Cassidy here, Telephone Town Hall. If you want to ask a question, make a comment, press star 3. And by the way, we're going to have a poll question. I'll announce this several times. And the poll question is, do you favor President Trump's one big beautiful bill? If you do, press 1. And if you don't, press 2. Now, and I think you can just do that. Let me see. Are we going to put that up for people to click on, or when do they actually know when to vote?
I think it's at the end, sir.
We're going to check and see we'll check with our operator to see when you exactly will vote. But we're going to be bringing that up, and we're going to ask you to vote 1 if you like the one big beautiful bill from what you know of it, and 2 if you don't. Lastly, I want to give some follow-up. In January, a bill that I really worked hard to pass in the Senate to repeal the windfall elimination provision and the government pension offset, WEP and GPO is what they're called, was signed into law. It was a little touch and go for a little bit. I was working with another senator to overcome some resistance. President Trump joined us, tweeted out that he supported the bill. That made it happen, and now we've got a bill that passed. It's great news for teachers, nurses, firefighters, public sector workers who, because of WEP and GPO, did not receive the Social Security benefits they earned. Now, just 6 months later, 91% of those benefits have been back paid. I'm looking forward to it being 100%. I think it's over $570 billion going to over 70,000 workers. Huge win for Louisiana, huge win for our workers. My last news is if you just joined us, Senator Bill Cassidy here. And if you have a question, want to make a comment, press star 3. By the way, we said we're going to have a poll. If you like the one big beautiful bill, which you've heard of it, press 1. If you don't like the one big beautiful bill, which you've heard of it, press 2. Lastly, I'm going to finish up with this, and we'll start taking our questions. And I'll make that announcement a few more times. The bipartisan infrastructure bill, which I worked really hard on to get money for infrastructure in Louisiana. We've received billions so far from it. We just received another $5.8 million for airport infrastructure, upgrading airports in Farmerville, Ruston, Oak Grove, Manny, Lake Charles, and Abbeville. Now, you have somebody that wants to make a major investment in your community. Typically, those folks fly in. So having an airport at a smaller community that can actually receive a plane flying in from Dallas, Houston, or New Orleans is important, because that's where the person who's going to make the investment decision, that's how they're going to get there. So I'm pleased we're upgrading those airports. Louisiana is benefiting from the Infrastructure Investment Jobs Act, bipartisan infrastructure bill, same thing. And so I'm pleased about that. Again, if you just joined us, Senator Bill Cassidy, if you got a question, want to make a comment, hit star 3. If you want to vote as to whether or not you like the one big beautiful bill, what you know of it, press 1 if you like it and 2 if you don't. And now we'll go to our first question. Hey, John, you're up. Tell us where you are. Tell us where you're from.
I'm sorry, who's up?
John.
John, yes, this is hi, Dr. Cassidy. I've talked to you in the past. I worked at Borderlands Pharmacy around the corner from you at OK Long.
Oh, yeah.
Yeah, I have a question about the fentanyl patch. Is that in any way included? Because I have a number of cancer patients that we have, and it works so well for them. Is that in any way going to be constrained within this bill?
No, it's not, John. You're a good pharmacist. By the way, my mother's passed, but she was on fentanyl patches at the end of her life, and as a doctor, I know they really work well. So the medicinal use will not be affected. The ability to do research upon these fentanyl analogs will not be affected. It's just if a criminal is trying to sell it, they can't claim the excuse it's not technically fentanyl.
Okay, very good.
Great question, man. The kind of question I expect from a pharmacist. I appreciate that. If you just joined us, Senator Bill Cassidy, taking your questions. If you have a comment, want to make a comment or ask a question, press star 3. And then if you want to vote on whether or not you like the one big beautiful bill, press 1 if you like it, if you like what you've heard so far, and 2 if you don't. And our next caller is Stacy. Stacy, tell us where you're calling from.
I'm calling from Allen Parish, Kinder, Louisiana.
Yes, ma'am. I was just speaking about Oakdale today, so
yes, sir.
You've been on my mind, if you will.
Yes. As far as the fentanyl, I a teacher, so I know I've lost kids that I've taught to fentanyl. But I agree totally with trying to get rid of it, and then I just agree with the pharmacist ahead of me. But I want to bring up another point because you were saying about we're talking about medical. I'm not for the big beautiful bill. It's going to raise our income, not ours, but the country's, and then it's going to take Medicaid away from some people that really need it. I'm a Christian. I voted for you. I voted for Trump, but I'm not for taking away poor people's benefits.
Hey, Stacy, can I respond to that?
Sure.
Boy, first, I'm sorry. A teacher always stays connected to her students, and the fact that you've lost some to fentanyl in Allen Parish tells me just how much this drug has penetrated our society. So I'm sorry for those losses. Let's talk about Medicaid. You know, it turns out no one has to lose their Medicaid benefit, period. The people that they've spoken of that would be affected are, what the requirement is that you have to, if you're able-bodied, you're not disabled, you're able-bodied between 18 and 64 with no dependents, and you're not working, volunteering, or going to school. That's who would currently lose. But if you just decide to volunteer at the local food bank 20 hours a week, or go back to your local community college, or get a job at a fast food restaurant 20 hours a week, you keep your Medicaid. Now I can tell you, as a doc who used to work in the public hospital system at Earl K. Long Hospital, kind of the charity hospital of Baton Rouge, when people work, they're better off. They have more structure to their life. They are statistically less likely to do drugs. They engage with other people and get out of their house. So it's actually good for your health to work. If unemployment goes up and there's a recession, there's a provision that waives this and allows people to be on Medicaid even if they don't get a job, although they could still volunteer and they could still go to school. So Stacy, I appreciate your Christian concern that people should have health care. I spent my life trying to do that in the charity hospital system. In this case, if you're willing, if you're able-bodied and no dependents, and you're willing to volunteer work or go to school for 20 hours a week, you keep Medicaid, and there's no loss whatsoever. Stacy, do I still have you? Stacy, I've lost you. I'm sorry. Thank you, Stacy. Thank you for teaching. Everybody, Senator Bill Cassidy here. And by the way, Stacy brought up the one big beautiful bill. If you want to take our poll question, if you like what you've heard of the one big beautiful bill, press 1. If you don't, press 2. I'm curious to see how this plays. That's the first thing I want to say. If you have a question you want to ask or want to make a comment, press *3 on your phone dial. Star is that button lower left-hand corner and the number 3. And our next caller is Colleen. Colleen, tell us where you're calling from, please.
I'm calling from Lake Charles, Louisiana.
Hey, Colleen. Thank you for being on. What's your comment or question?
My question is, you speak of the benefits for I'm a senior citizen, and you speak of the benefits for senior citizens. I'd like to know what's the specific in the tax bill that will benefit me as a senior citizen.
Yeah, so the great question. Thank you, Colleen. Right now, people above a certain income level, when they receive their Social Security payment, pay a tax on that Social Security payment, an income tax. That started under Bill Clinton when they wanted to just get more income for the government. One of President Trump's campaign promises was that he wanted to not tax Social Security. Now, I won't go into the process reasons why, but the specific benefit is that it gives a senior citizen up to a certain income a credit so that if they are paying income tax on their Social Security income, they're held harmless. So in effect, they won't be paying taxes on that Social Security benefit. You'll have more money in your pocket, bottom line. So Colleen, thank you for allowing me to make that clear. And that's a great question, by the way. I don't think I've had a question as particular as that, so thank you for that. Our next, and we're moving quickly because we've got a lot of people. And if you want to make a comment or ask a question, press *3. And again, Senator Bill Cassidy here. And if you want to vote on the One Big Beautiful Bill, press 1 if you like what you've heard, and 2 if you don't like what you've heard. And now I'm going to go to Brenda. Brenda, where are you calling from in our great state of Louisiana?
I'm calling from the capital city of Baton Rouge.
Hey, great to have you on. Thank you.
Okay, thank you. I think you answered part of my question with Colleen about the Social Security income tax.
Yes, ma'am.
Do you happen to know what the bracket is for income that's going to be affected?
Yeah, adjusted gross income up to $75,000 for a single person, $150,000 for a married couple.
Okay.
That's off the top of my head. Now, it's still a work in progress, so if it comes out just a little bit different, excuse me for that, but that's just the latest thing I saw.
Yeah,
Brenda, did I lose you?
Here, can you hear me?
Now I can hear you.
Hello?
Go ahead.
Yeah,
yes,
okay.
ma'am, I got you.
Back when Clinton started this tax, it's really we've already paid taxes on this money once, and it shouldn't be taxed again, no matter what your bracket is. That's my point. Okay.
Yeah. So the president heard that on the campaign trail, and and we're trying to address that. Hey, thank you, Brenda. They're moving me on. I got somebody sitting here who's pacing me, just because we got a lot of people who want to ask questions or make a comment. And if you are on right now and you want to do so, Senator Bill Cassidy here is *3. And if you want to vote on the One Big Beautiful Bill, press 1 if you like what you've heard, and 2 if you don't. Our next caller, I think, is Margarita. Margarita, tell me where you're calling from, please.
I'm calling from Kenner, Louisiana.
Hey, thank you for being on. I appreciate it.
Well, I support the Big Beautiful Bill, and I support Trump. I support you. And my question is, what is going to happen to FEMA flood insurance?
Yeah, so Margarita, that is something of concern to everybody in Louisiana. And just so folks understand, there's property and casualty, think wind damage, and that is the state-run issue. And then there's flood insurance, which Margarita is asking about, which is flood insurance, which is a federal-run program. I've been pushing reforms for this about 5 or 6 years now. Some of them have already been incorporated, but I'd like to redo the whole bill. We've got something that we're pushing right now with the banking committee. John Kennedy, my good colleague, is on banking committee. We're working with him and a couple other Republicans and Democrats because we'll need Republicans and Democrats to pass the legislation. And so I'd like to tell you a reform bill will happen this Congress. Can't promise, but I can promise you that we're going to work our hardest on it. We've just sent a letter for those people affected by flood insurance. You may be familiar with the Risk Rating 2.0. It's a new system which is rapidly raising premiums. And so I've just led a letter with fellow senators and members of Congress to the administrator and ultimately to President Trump, asking them to put a pause on the flood insurance premium. And lastly, I've been directly speaking to the acting administrator of FEMA, who frankly had some misconceptions about the program. He thought the only people seeing higher premiums were people who had flooded. I said, nope, I got people who have never flooded, and their premiums have gone up 500%. And so we're pushing it in multiple different ways, Margarita. I understand it's an issue, and we're going to work on it until we fix it. Thank you for that. I wish I'd asked you about your experience. I bet you would have told me that your premiums were sky high. I apologize. Again, I'm getting moved on by somebody who's looking at our list of people. So if you want to vote, and I just keep repeating this, and we'll announce the results in a little bit, on the whether or not you do or don't like the One Big Beautiful Bill, press 1 if you like it, and 2 if you don't. and if you just logged on and you'd like to make a comment or ask a question, press *3. And our next caller is Phyllis. Hey, Phyllis, tell us where you're calling from, please.
Yes, I'm calling from Covington in St. Tammany Parish.
Okay, great.
And how are you today, sir?
I'm doing really well. Thank you for asking. How are you?
Oh, just marvelous. Living the dream.
You know, Louisiana is a great state to live in, and St. Tammany is a great place within a great state.
It is. We've moved here 10 years ago from Las Vegas, so
wow.
We're loving it. Yeah.
Good for us. Good for us. What's your comment or question?
Well, my concern is the infrastructure in the state. You had mentioned something about monies that have been allocated for infrastructure. I know you were talking about the airports. My concern is it's a twofold with the infrastructure, but with the school systems as well, is the concern that in Covington, it is a growing area. I'm glad to see that. But at the same point, the road systems are horrendous. I don't understand why thought processes when you're building an additional 12 to 1,500 homes, and we've also had in our council meetings blocking a property company from adding on probably another 1,300 homes in the same area because the roads are just backlogged. It could take you 20 minutes to go 3 miles. And I also don't understand why, since we are a very flat area, that in the infrastructure there were never bicycle lanes put in, which could help alleviate some of the traffic issues.
So, Phyllis, let me just comment on several of that. Now, the schools are going to be a local issue. And so that's going to be a local millage or a local sales tax that's going to support the whether or not there's a school. But one thing I was privileged to work on was the Infrastructure Investment and Jobs Act, also called the Bipartisan Infrastructure Bill. And that brought $5.9 billion to our state to build new roads and bridges and to widen and repair the federal roads we already have. Now, the state legislature matches that with some state dollars to stretch that out, but those dollars are rolling out now. There's also money for sewer and water systems that we continue to work on. There's money for the Lake Pontchartrain district, so the communities bordering Lake Pontchartrain have access to dollars to help with drainage, flooding, as well as sewage treatment, because some still have old sewer systems that were overflowing into the lake. There's money for broadband internet, which is about to be released. There's money for airports, as we spoke of. I could keep going. But there was a lot of dollars in there that hopefully over the next year, 2, and 3, you'll begin to see the fruits of. That said, St. Tammany is growing so rapidly, it's always going to have a local road issue, and both in schools as well as your local roads. That's up to the state and locals, but I'm doing my absolute best to help the federal program kick in, widen I-12, do other things that would make it easier to move around. Phyllis, thank you. And by the way, if you just joined us and you want to vote as to whether or not you like the One Big Beautiful Bill, press 1 if you do and 2 if you don't. And then, oh, by the way, one more thing on infrastructure. You can go to my website, cassidy.senate.gov, and you can click up there, and there is you'll see it very clearly. Cassidy's Infrastructure Investment and Jobs Act has delivered $10 billion to Louisiana, and you can click on there, and it'll bring you to your parish, and you can see the projects from the infrastructure bill in your parish. So anybody interested in that, more power to you. Thank you. Our next caller, I think, is Gayla. Gayla, can you tell us where you're calling from?
Yes, I'm in the city of Central in East Baton Rouge Parish.
Great to have you, Gayla. Am I pronouncing that correctly?
Yes.
Got it.
First of all, I want to say thank you for your hard work on the elimination of GPO, WEP. I was affected for 10 years after retiring from the state, so it's been a major blessing for me. Now, my question that I want to ask you about is, I know that the House passed a bill that temporarily gives senior citizens an additional $4,000 tax deduction rather than tax elimination for Social Security benefits. Okay, my daughter is a CPA, and I asked her once that bill passed, I said, how does this affect my tax liability? And she said that if Congress had passed a $2,000 non-refundable tax credit, it probably would have eliminated my tax liability. But the $4,000 temporary deduction is not going to eliminate it. So my question is, can this be changed from a deduction to a non-refundable tax credit for seniors?
So the president's promise was to address the tax on Social Security. And so that's what he asked us to do. The House version, it sounds like it was specifically trying to fulfill the extra obligation that would come from a taxes on Social Security. But if somebody's got a second job, or if they're continuing to work, or if they've got investment income, that would, rental income, that would be unaffected. So the purpose, again, if you've got rental, investment, et cetera, yes, you'd still pay tax on that. The president's promise was to try and eliminate the tax on social in particular. Now, just for anybody that watches too much C-SPAN, we're not allowed to directly say in a reconciliation bill, you don't have to pay taxes on social. So we did the next best thing. We estimated the amount that someone would pay if they were paying, and we're giving that credit. And that's how that process worked. So Galen, I wanted to explain it to you, and I hope that works for you. I know you'd like to have no tax liability, but the president had kind of a different sort of a sense as to how to approach that. Thank you all for joining. Senator Bill Cassidy here. If you got a question, want to make a comment, press *3. You'll be spoken to by someone who will take your question or comment and put you in the queue. If you want to vote as to whether or not you like the one big beautiful bill, press 1 if you like it, and 2 if you don't. Hey, Bruce, tell us where you're calling from, please.
Calling from Shreveport.
Hey, I think we've now got all 4 corners of the state. We still need Monroe. We still need Northeast. But turn it to you, sir.
Appreciate the chance to ask you a question. The question, Senator, is this. You are being attacked now on television by some vague pack, I don't know who they are, that are saying that you are actually harming your legislations, harming seniors and the Medicare program particularly. A lot of that you just commented on, I know. And I'm sure it's too complicated to go into right here, but is there a place that we can look at what they're saying and look at what the truth is on your website perhaps, or where can we figure out what this issue is? Because it's very vaguely stated and clearly very biased.
Yeah, it is very biased. By the way, there's nothing in the reconciliation bill, literally nothing, that deals with Medicare. But there are some people mad at me because I proposed that insurance companies, which are being prosecuted criminally and civilly for the way that they are manipulating people's medical histories, not be allowed to do that. They are being prosecuted.
Good.
Now, I wanted to pass a law to forbid it, and that's why these people are attacking me. But Bruce, being attacked in this job for doing the right thing is part of the job. By the way, that would have saved taxpayers $275 billion. Think about that. Medicare is going insolvent, and we had a chance to save $275 billion over 10 years for the Medicare program. Ultimately, however, the president said he didn't want to touch Medicare in the one big beautiful bill. We took it off, but it's something that I'll look at later because we've got to We've got to control our spending. We've got to support the Medicare program. We've got to do the right thing. And if people are going to run ads against me, I guess they're going to run ads against me. I appreciate that, Bruce. Thank you for that support. And if you just joined us and you want to vote on the one big beautiful bill as to whether or not you like it, press 1 if you like and 2 if you don't. And our next caller is Deborah. Deborah, where are you calling from?
Hi, Dr. Cassidy. I'm calling from Hammond, Louisiana, Tangipahoa Parish.
Thanks for being here.
The reason why I'm calling is I want you how much I appreciated how you got the windfall bill passed. I have been working with your colleagues since Senator Vitter was in office to get this changed. And one of your colleagues, Congressman Scalise's office, would keep me updated, but it just became stagnant, and I was kind of losing hope. I emailed your colleagues, I kept calling, and I'm just so grateful to you for getting that passed.
Yeah, I appreciate, Deborah, that it started in the House, but it was about to stall out in the Senate, as I was speaking earlier. Susan Collins from Maine, she's had a lot of weapon GPO in her state. I got up there and spoke about how the people in my state, the nurses I used to work with in the charity hospital system, the longtime local and state employees, the first responders, were the ones being affected by this. And then again, the president heard about it, tweeted support, and all of a sudden, that's what we couldn't get done. It got done. And Deborah, thank you for commenting. I'm just appreciative that you have benefited from it, and thank you for acknowledging my role. I thank you for that. Our next caller is Carl. Hey, Carl, tell us where you're calling from, please.
Hi, Senator Cassidy. I'm calling from Alexandria, Louisiana.
Hey, thanks for being on, sir. What's your comment or question?
Well, my question is that, you know, I've heard different figures thrown out in the media about how much the big beautiful bill is going to add to the deficit to the tune of anywhere between $2.5 trillion to, you know, upwards from there. And I want to know how are the working class people in the state of Louisiana and really all over the country going to make up for that deficit with the tax cuts that are going to go to the upper echelon in society, the upper 1 or 2%. And just a side comment that, you know, I'm a pharmacist like John, and, you know, back in 2016, I was making 6 figures a year, and I paid 25 times what Donald Trump paid in income taxes that particular year. He paid $700. So how do we justify to the working class public that we pay a higher percentage of our income as opposed to those in the top tier?
Okay, so let me jump on this. You ready, Carl? First, the top marginal tax rate is 37%. And obviously the lowest marginal tax rate is 0, and then it escalates up from that. Most people in Louisiana probably pay somewhere between 15 and 25%. So again, the top marginal tax rate is 37%. As it turns out, the people in the top marginal tax rate, top couple marginal tax rates, pay most of the tax revenue. I forget the exact percent, but if it was 70%, I wouldn't be surprised. Now, what about the big, beautiful bill itself? The one thing we cannot take into account is the money that we're going to get from the president's tariffs, but that has been estimated as being $2.8 trillion over 10 years by the Congressional Budget Office. If you put that together with the savings that we have in the bill, anywhere from about $1.4 trillion, that's a moving target, just because things are being added and things are being taken away. And then if you add that to the economic growth, you can dispute as to whether or not this adds to the debt and deficit. Different estimates are that the economic growth, that it will increase economic growth. I'll point out that when we passed the Tax Cut and Jobs Act bill, there were increased numbers of jobs, better paying jobs, and those were disproportionately in the lowest 2/5 of the economic strata, meaning working families and middle-income families were the ones who had the increased growth in their salary as a percentage of the whole economic pie, if you will. There's also some provisions directly benefiting people who are, say, working. So, for example, no tax on overtime, a break for those beneath a certain income level if they decide to buy a new car, the no tax on tips. There's also an increased child tax credit. So for families with children, they'll have a little extra money to help raise that child. And so there's different ways in which working and middle-income families are going to directly benefit from this. And then to say once more, if the issue is as regards the debt and deficit, if you add the tariffs in with everything else, I think the whole thing will end up decreasing our D&D, if you will, our debt and deficit. Thank you, Carl. Let's announce our poll results. What's our poll results? See, I'm looking here. It looks like about 63% of the people liked the big, beautiful bill. 444 people voted they liked it, and 261 don't like it, or 37% against. So about 2/3 like the big, beautiful bill, and 1/3 does not. Last caller, because I have to say this unfortunately will be our last caller. I just got the yank sign. Hey, Larry, tell us where you're calling from, please.
Yes, hello?
Hey, Larry, you're up, man.
Hello?
Yes, sir. Larry.
Yes, I'm calling from Jefferson Parish.
Hey, thanks for being on.
Yeah, my wife worked for the school system, and I know what you did with the Fairness Act, and yes, we are finally getting, her, which should have been her benefit from the Social Security. They denied her getting the back pay because we didn't apply for it before, but when we went down there to go do it, they kept telling us, why? You're not going to get anything. When we finally applied in November before the COLA went up, we knew that even without the big, beautiful bill, she would get something. They didn't even go back today. They just started her in January. We've been married for almost 50 years, and we would have gotten it as soon as we could have get it, but we kept getting told we couldn't get it.
So do me a favor. Call my office in Baton Rouge, 225-929-7711, 929-7711, area code 225. Say you've got a Social Security issue, and one of our caseworkers there will take this on for you. And anyone else who's had an issue achieving their back pay for a weapon GPO, 225-929-7711. And by the way, if anyone has a problem with the VA, with their Medicare benefits, they need a passport suddenly, or anything else with the federal government, look on the website, cassidy.senate.gov, or call that number. Y'all have been a great group. Thank you for joining on to this telephone town hall. I'm just privileged to be your senator, and God bless the United States of America.